YouTube, Dr. Dobson, how's it going? Twitter. Where else are we going live? We're going on LinkedIn. We'll be there. So what's going on, y'all? Dr. Barry here. We are live this evening, Friday night. If you could tell in the background, I'm on night shift this week, right? And I figured, you know what? Let's go live. Let's talk some COVID. Let's do a little COVID update. We haven't done one of these. So if you've got any questions, this is where we typically answer any questions that you may have that you may have not gotten, especially kind of listening to the podcast, the YouTube or whatnot. Right. So we are obviously this is COVID. If you got questions, drop them in the comments, especially if you're watching me on all of my other platforms, YouTube, like it pops up here. I'm not sure how it does it. It does pop up here. Of course, we have Instagram, so you're going to see me kind of turn to the right occasionally because I'm also going live on my Instagram as well, right? Because they're the ones who really wanted me to go live, right? And we're just kind of giving the blessing, pleasure to everyone else, right? So again, for this is your first time catching me, I am Dr. Barry Pierre, board certified internist, hospitalist physician, founder of drbarrypierre.com, Pierre Medical Consulting. We do lots of things, especially in the health content creation standpoint, podcasts, YouTube videos, lives, ebooks, all things under the sun, really to kind of educate you, right, to get and empower yourself for better health, right? That is the motto. As you can see here, you can peep the shirt, empower yourself for better health. That is the goal. And we're going to be talking about COVID-19. Like I said, I know, especially now, I think the way the TV has gotten it, right, where they don't even really talk about it as much as they should, right? People are kind of going outside again. Outside's opening up, right? So you may have this belief that COVID-19 is either getting better or going away or we're almost out of the pandemic. Unfortunately, that is not the case. Right. So obviously, I always like to start these things off kind of giving some facts just so we can kind of get into the mindset of what we're doing. What is COVID-19 doing to us here in the United States, bro? What's going on? My brother Lars Jetter's in the building. Superb accountant. But he does big, my accounts are too small for him, right? So he doesn't even do my type of accounts, right? Like just to give you an idea how big of an accountant he is, right? So let's talk about COVID-19. Let's give some updates worldwide. No, first off, we'll start US, right? We like to start US, and we'll talk about that in a second. In the United States, as I speak, 46.8 million cases of COVID-19 since the start of the pandemic. We have had 759,000 people die. Right, just here in the United States. Let's talk about the worldwide total of 252 million cases of COVID-19, with about five. He's being shy, y'all. He's being shy. I promise he can't even look at my accounts. I ask him, like, he won't look at my accounts. Like it just is what it is, right? 252 million deaths. I'm sorry, 250. Oh, that'd be bad. 252 million cases of COVID-19 worldwide, with about 5 million deaths total here since the start of the pandemic. Of course, let's talk about vaccines because obviously vaccines and the treatment of COVID-19 is such a huge thing. Here in the United States, we have 192 million people who are fully vaccinated against COVID-19, with about 224 million people having received at least one dose, right? 224 million, right? So a lot of people here, right? Total vaccinated, roughly about 50%. Worldwide, we have 3.16 billion, and that means billion with a B, fully vaccinated, with 4.04 billion partially vaccinated, right? And those numbers are especially for the people who are like, oh, I'm going to wait to see enough people get the vaccine before I get it. Right now, the count is 3.16 billion. I don't know what number you're waiting for, but like if 3 billion is not enough for you to be like, all right, I've done my due diligence, you're probably not going to get it, right? So here in the United States, Pfizer vaccine, Moderna vaccine, Johnson & Johnson, those are our three choices. I know worldwide there's a slew of other different choices as worldwide from a vaccination standpoint, but obviously I'm here in the United States, so I'll talk about what we got here in the United States. But more importantly, I want to kind of hash on this level of concern, right? Because here, and I see this all the time, here we live in this bubble here in the US where, everything world revolves around us and all the problems revolve around us. And understanding that when we step outside of this country, right, like there is still a significant scarcity when it comes to getting vaccinated. still a scarcity when it comes to getting vaccinated, right? Just give you an idea. World Health Organization has a program called COVAX, right? The job of that program is to be able to get vaccines to countries that are third world or just poor than the upper level countries. And let's just give an idea. Only 20% of people in low and lower middle income countries have received at least one dose of vaccine, compared to 80% in high and upper middle income countries, right? So when you talk about people acting like we need to kind of move forward, understanding that they're talking, I was on a person's live, and they were talking about how here in the United States we are very geocentric, right? Like everything is us, and we don't necessarily think about what's going on like across the world, right? So again, like those numbers in November 2021 is staggering that in lower and middle income related countries, only 20% of people have received their first dose, only 20%, versus the higher, the countries that, got more money, right? Got more resources, right? At least 80% of those have at least gotten one dose, right? That is a problem. That is concern, especially because when we talk about a pandemic is a worldwide thing. So we can't isolate ourselves and be like, well, the United States is cool, the United States is fine, and then all these other countries across the world are not, right? It's just like absolutely, disheartening when you think about if we're going to get over the hump of this pandemic, because we are still knee deep in this pandemic. If we are going to get over the hump of this pandemic, right, it's going to take a worldwide effort, right? And unfortunately, we are still not doing a very good job. How's it going? Doing a very good job in getting the treatment to the people who want it and need it, right? Which is want is probably a big thing as well too, right? And thank you for joining, right? Because I was just talking about the aspect that despite, especially here in the United States, we're very geocentric. We kind of think about ourselves. And I dropped this stat that 20% of people in lower and middle income countries have only received one dose, right? Only 20%, right? Versus in high and upper middle income countries, that number is as high as 80%, right? So we are still having a problem, not with like needing a vaccine, right? Like if we remember what it was like before we didn't have the vaccine, that was we had no treatment, right? So we were just kind of throwing the kitchen sink at everybody. We don't have that problem now. The problem we have is that the people who want to get it can't get it. The people who need to get it can't get it. And more importantly, at least, and definitely worldwide, but definitely here in the United States, the people who should be getting it don't want it, right? Like, so we have so many different hoops and obstacles that we are still having to kind of jump over and leap over. That's really dragging this pandemic along. Like I said, we're gonna hit 2 months in a few months. I mean 2 years of this pandemic in a few months, and like there's no signs of the pandemic slowing down, right? Delta variant, for those who may not know, unless you've been living under a rock, the Delta variant has severely pushed our timetable back in saying like, yeah, I thought we would have gotten out of this at the end of 2021, but the Delta variant has essentially wiped that away. And there's still parts of the world. I was reading an article like in Russia that they're still being decimated by the Delta variant, right? Like most of them, especially here in the United States, we've gotten over a lot of the biggest waves and surges here in the United States, but the rest of the world, again, when we think about pandemic, it's not just us. The rest of the world is still being severely affected by it. And how, things travel, right? Like, so it's not like a person who is maybe in an affected area is only going to stay there, right? Something's going to happen. They're going to travel. They're going to end up here, and then it's going to happen again. Holidays are coming. I think we're going to see, if we don't see a surge around Christmas time, I fully expect to see a surge between that January to February timeframe. Like I just think that's going to be the play, especially when I look on TV and I look and I see, outside's opening again and people are out and about. And again, you just you have a sense that, especially here in this country, that a lot of people want to move past it, but we're not necessarily at that point, right? Guy, what's going on? We're not at that point where we could just kind of go and say like, all right, yeah, we don't have to worry about COVID-19. Like that's over and done with, right? And my country take AstraZeneca, no booster for it due to lack of electricity. See that, and this. So I'm on Instagram, and one of my supporters, right, says that in his country, and I believe it's Nigeria, in this country they have AstraZeneca, and there is no booster for it because we know AstraZeneca has not come up with a booster for it. We'll talk about that in a minute. And due to the lack of electricity, there is no facility to store Pfizer and then obviously Moderna, because we know the way Pfizer and Moderna work is that they have to be stored in freezer-related temperatures, right, just to be able, right, to like house it, right? If you can't store the vaccine, you can't have it. And that's why, and we have another user, a friend of mine, Guy, talked about how Johnson & Johnson, the booster, again, here in the United States, is definitely going to be emergency authorized use probably within the next month or so. But like that's why AstraZeneca, that's why Johnson & Johnson and these other types of medications are going to be so important, because there is a reality that there are certain parts of the world that will never get Pfizer, that will never get Moderna, specifically because they do not have the resources to house those medications. That's literally the only reason why, that they do not have the resources, again, which we have, especially here in this country and some parts of the country, an abundance of resources, too much of resources. And because those resources are concentrated, you have parts of the world who don't have those types of resources, right? Which again is, one of the biggest issues and concerns, especially when we kind of move forward, as far as the treatment is concerned, right? So we kind of mentioned, some of the treatments, right? We know about the Moderna, right? 2-dose. We know about the Pfizer 2-dose. And here in the United States, we know that the Pfizer is the only, and I have to stress this because this always kind of gets lost, is the only FDA approved vaccine. Now, yes, you can still get Moderna. Yes, you can still get Johnson & Johnson, but those are under emergency use. Now, I tell people that, but I always put it with an asterisk, because it's really not a if Moderna will get FDA approved, but when. They've already turned an application in. Probably by the end of December, they'll be FDA approved. Johnson & Johnson still has not turned in an application in yet, but by the time they turn it in, which I think is going to be probably 2022, January, February, they'll get approved as well. So it's not a matter of is there something that they're worried about that they're not giving them the okay. They just literally have not turned in all of the data and the application and everything needed to get that final FDA approval. So when I say FDA approved, I'm only talking about Pfizer vaccine. And we just had some amazing news just recently that not only is it FDA approved, especially for those who are of age 12 and above, but now kids get the ability, if you're Pfizer, to actually get the vaccine as well from ages 5 to 11. In fact, my kids are actually going to be scheduled to get their vaccines tomorrow. Like, I can't wait for that to go down. It is a 2-shot dose. And one of the biggest differences in the age groups of 5 to 11 is that they get a third of the dose that the adults get, right? So the adults get from 12 to up, they get an adult dose. The kids 5 to 11 get a third of that dose. Reason being is that they wanted to see what is the least amount of medication I can give and still get the same amount of oomph, right? Get the same amount of antibiotic response. That's what they tested for. And of course, the big thing, remember what we talked about, the vaccine's job is to prevent death, severe illness, hospitalization. It is not to prevent you from getting COVID. It is not to prevent you from getting COVID. Let's make sure we scream this from the rooftop so you don't have anyone say like, oh, I still got COVID after getting the vaccine. Yes. That was never an issue. That was never a concern of ours. And again, interesting, especially going back on the AstraZeneca. I know we are still waiting, because it's interesting, like AstraZeneca, like I'm actually surprised they didn't move forward with their data here. I know they had a lot of issues, especially in the beginning, but it kind of faded. So like you would have expected AstraZeneca to be over here in the United States as well, but again, things just didn't happen and they haven't gotten to that point yet. But now as we move forward, right now, it's because it's been so long since these vaccines have came out, right? At least initially, that now we're talking about boosters, right? Which was always, especially if you've been following these lives or catching the podcast episodes, I talked about the fact that like we should get it in our mind that COVID's not going anywhere, and that you should expect, not like hope, but you should expect to have to like take another vaccine later on, whether like just like we do the flu, like the flu comes yearly, you should expect that to occur. And we have official abilities to, from the Pfizer standpoint, to get a booster. Recommendation is 6 months after you got your initial. Johnson & Johnson as well. And remember, Johnson & Johnson, the biggest difference with Johnson & Johnson and the Moderna and Pfizer outside of their class was that you only took it one time. And a lot of the backlash, which is weird, but a lot of the backlash I would hear about the Johnson & Johnson is like, oh, it's not as effective, right? Because they were always looking at that 92, 94%, hospital prevention of hospitalization. So like that was always a concern. Now, mind you, it was still like 88, like it wasn't like a slouch, but people would always compare it to Moderna. But with the new results of the Johnson & Johnson booster, that number is boomed up right into the mid 90s. So like just amazing findings for patients who get a booster dose. Now, here as I speak, those who are eligible for boosters are those who are like at high risk occupations, 65 and older, those who are immunocompromised. I fully expect probably down the line, you'll see them kind of loosen those restrictions to allow more people to be able to get it. But at least at this point, and because it's a booster, it's still under emergency use authorization, right? And again, I have to use those terms, right? Because if I say something's FDA approved, that means a certain thing, right? But if I say under emergency authorized use, are you getting a different medication? No. But you just want to know, especially from a legality standpoint, right? And especially when I talk about those who are against, getting the vaccine, right? A big thing for them initially was, oh, it's not FDA approved. It's not FDA approved. It's not FDA approved. So of course, once it became FDA approved, there was another reason why they didn't want to get it, which we already knew, right? I've said this on this on this live series on a podcast, like that we shouldn't hold to dear life that like the only reason why they didn't get it is because it wasn't FDA approved, right? Because I knew that once it got FDA approved, that you were going to hear another reason why they weren't going to get it anyways, right? So again, and that's just one of those things where I was having a good conversation with a couple of my colleagues when we talk about, like when especially I get on here and I'm educating and I'm like I do that the Real Physician Reacts on Tuesday. Make sure you subscribe to that on my YouTube channel. And I was talking about when do we choose to like educate and who do we choose to educate? There are still people here in November 2021 who don't believe COVID is real, who don't believe the vaccines work. Those are the people that I counsel my colleagues, my healthcare colleagues, my public health colleagues, like those are the people you're not going to get. And because you're not going to get to them, stop talking to them. Right? Like it's a waste of your energy. And then you can't delve your energy to answer questions to people who really have viable questions. Right? So you understanding who are you talking to and who's your population extremely important, especially when we do what we do here. So again, that's really kind of the nutshell of kind of the vaccine discussion. Like I said, I want to start off in saying that unfortunately the rich keep getting richer and the high middle income countries are hoarding a lot of the vaccines. And especially here where not only do we hoard the vaccines, we throw away vaccines, right? Because Pfizer and Moderna, they have a certain shelf life. It's not as long as the Johnson & Johnson or the AstraZeneca would be. And because it's not as long, if you don't have people who are getting the vaccine, they throw it away, right? And mind you, we're throwing away vaccines that other countries would go crazy to have. So again, there's just to think, especially here, and I always talk to my folks who are here in the United States that remember we have to think about COVID-19 as a significant global problem. And so when we're talking about vaccines, not taking vaccines, when we're talking about medications, not taking it, understand that there's people here who would get you out of the paint to try to get an opportunity to get that vaccine that you just willy-nilly say, I'm not going to do. right? Just understand that. So what's on the horizon? What is on the horizon? This is really I wanted to touch on, because I think this is going to be extremely important, especially in our fight, in our battle against COVID-19. Mind you, COVID-19 is not going anywhere. I want to stress this here. I said this in 2020, that we shouldn't be thinking that COVID-19 is going to disappear in 2021. Clearly, Delta and all these other things reminded us that, like, yeah, like for sure. So COVID-19 is not going anywhere. We are going to have to live, right, in a world where you can get COVID-19, right? We're going to have to live in a world. I was reading an article. No, I was listening to a presentation that talked about in our lifetime, and they were kind of this one. It was actually more focused on those who are not vaccinated. In our lifetime, those who are not vaccinated have a 1 in 3 chance of picking up COVID-19. Like it's not like they're going to be able to duck and weave it for the rest of their life. It's not happening. So like, and again, once you understand that like if you know you're going to get COVID-19, trying to do everything you can to protect yourself, and still that may not be enough, is something to think about. Because I think here in our country, in a lot of discussion with COVID-19 is the aspect of mortality. Like COVID-19 only, this is so crazy to me. COVID-19 only kills 1 to 3% of people. Like they say only, like that's okay. Like it only kills 1 to 3% people, right? Like why are we worried about it, right? For them, 1 to 3% is okay until you ask them who out of that 1 to 3%, which one of their family members are you okay with that being? Like once you ask them that, then all of a sudden it's a fumbling, right? All of a sudden it's a mumbling. Like there's usually no answer. So, and again, and that 1 to 3% includes older people, it includes kids, and includes a lot of people who are young. But the discussion I try to have now, and I'll probably have a whole podcast discussion on it, is this aspect of the morbidity associated with COVID-19. And by morbidity, that means like the people who get COVID-19 and are fortunate enough not to die, like what is their life like? Because morbidity is typically a more chronic related issue, something that we see, like the way people talk about, like, oh my God, this vaccine, you don't know what the vaccine is going to do in 2 to 5 years, even though we know, and I've said it before, so we'll educate now, that a vaccine, the way the vaccine works, there is no chronic issues that you're like, if something's going to happen, it happens quickly. It happens right then and there. It happens with, like, it's not something that like in 10 years you find out like, oh, that vaccine I took caused a, like, no, like that's not the way vaccines work. And so when we talk about morbidity, I think is going to be the more important discussion. Morbidity shows that, hey, I got COVID-19. Like, for example, I'm doing nights right here in my long-term care facility. I'm taking care of multiple people. In fact, right now I got like three people right now who I'm taking care of under the age of 45, right, who are on a trach with the hole through their neck to breathe that's connected to a machine who has a feeding tube. They're under 45. They're all none of them are vaccinated, right? Like they didn't die, right? So they're not going to be in that 1 to 3%. But if you ask them, like, what's their life going to be like moving forward, it's not going to be the same. And can I tell you 100% that if they got the vaccine, they probably wouldn't see me? No. But I could tell you with a good probability, about 90% chance that they likely wouldn't be here seeing me. And if you ask them, like, if you had an opportunity, right, to not see me, right, like if you had a 90% opportunity not to see me, not to have a trach, not to be connected to a vent, not to have a tube, right, feeding you, I think a lot of people would probably take that. Right, like I'm just being honest. I think a lot of people would probably take those odds now after the fact. So I think we're going to have a discussion, especially over the next few years, right? Is this aspect of the morbidity effects associated with COVID-19, not the mortality. We know the mortality is there. We know 1 to 3%, and we know that there are a lot of people, right? Because I hear them, I see the comments. Right? There's a lot of people who are 100% okay with 1 to 3% people dying. They're 100% okay because in their mind, they don't think they're going to be the 1 to 3%. They don't think their family members are going to be the 1 to 3%. Right? Like they are 100% okay with 1 to 3% dying, and like they can wash their hands. I'm not. right? And because I'm not, like, this is why I do what I do, and a lot of my health content creators, again, just look at the podcast. We've probably done, I mean, since the podcast started, we've probably done like 20 episodes specifically talking about COVID-19, right? And I've had experts on top of experts, from, travel related experts, ER physicians, infectious disease, public health. Like, there's a lot of people who actually do care about that 1 to 3%. So I think what's going to happen is that I think once we do get it out of this pandemic, because if this is the question I always get, when is this pandemic going to end? One, it's not ending. I'm sorry, I'm on call, so I gotta make sure no one. I gotta make sure I don't have to run out the room. It's not going to end until those lower, poorer countries start getting enough of that vaccine or the opportunity to get it. All right. So first and foremost, like, if you don't hear that, in fact, this was a stat that I was like hurt to like even have to go over. Let me just read it. In Africa, less than 10% of Africa's 54 nations are projected to hit the year-end target of fully vaccinating 40% of their people. Less than 10%. So until that number improves, we shouldn't be talking about getting out of the pandemic. That's not going to happen. It ain't going to happen, right? But we do need to talk about, like, because COVID's going to be here, what can we do about it, right? Because I know y'all want to be out and about. I know y'all want to go back to living your life. And what's happening now, on top of the medications that we have, the vaccines and whatnot, but we actually have two companies, Pfizer, again, because Pfizer is going to work against this COVID-19. Pfizer is going to work. Pfizer and Merck. You may know Merck. Merck is the same company that makes ivermectin. Now, caveat, Merck has told y'all stop taking ivermectin. It does not work for COVID-19. They already told y'all that. Whole nother discussion. We won't even delve into it here. But Merck, the company, said don't take ivermectin. It does not work. Now, if the company who would make money from you taking ivermectin is saying don't take it, I don't know, much more of a discussion. Fast forward. But like, now these companies are starting to bring up medications to treat COVID-19 if you happen to get it. Like, and I was on TikTok, right? I made a TikTok about it. And someone said, is this going to be like the Z-Pack for COVID-19? And really the answer is going to be yes. So now you're going to have pill medication. If they're pills, they're not a shot, right? Because maybe people don't want the vaccine because it's a shot. I don't know, right? Maybe that's a possibility. Right, there's gonna be, right now, Merck has already applied for emergency use authorization. It is not official yet. They haven't got the final okay yet. I think they will, probably next month or two, right? Like, I think it's a foregone conclusion because the numbers look good. But this is a pill that you can actually take, and let me get the name for you, just so y'all can do. Remember, the goal is always, research after I say something crazy. In this case, you don't believe me. For Merck, the medication is called Molnupiravir. I'm sorry if I'm, saying that wrong. The goal is to disrupt the replication of the virus, right? So essentially, stop the virus from replicating. The way they gave it to patients in the study is that it gave 4 capsules twice a day for 5 days. You know how like we do Tamiflu, right? 5 days, right? And after you get symptomatic from COVID-19. Right. So again, like high risk adults and younger comorbid patients. Oh, hold on for a second. Hey, Dr. Pierre. Yeah. All right. So emergency doctor will probably go down since yes, 100%. So that's Merck's. So that's coming, right? And then Pfizer has a medication called Paxlovid. Also stops viral replication. We probably won't see that till next year because their studies are early. But the studies is doing so well that they stopped them. They said, hey, like, clearly this medication works, right? So for y'all who are taking zinc and vitamin D and vitamin C and all this other stuff here, you now have another medication that you can take, right? If you get sick, right? Again, the same goals to prevent you from getting in the hospital, getting severely ill, and dying, right? Same goals, same goals, same goals. So we got some things coming, right, that are going to be, and I think that's going to be extremely beneficial, especially for countries, right, where they're still having trouble getting the vaccine. I think these two medications may be game changers. So very, very excited, like, for that to come. Like I said, Merck is likely going to come first. Pfizer likely not till next year. But again, we will start having the Tamiflu version of COVID-19. Cost-wise, I don't know. It's probably going to cost some money. You gotta be honest. It's probably going to cost some money. I'm not sure what insurances are going to do. I'm not sure if they're going to subsidize it for a year or so. I don't know how that's going to work. We'll have that discussion when that discussion gets here. But just understand that you do have medications in the pipeline that aren't the vaccine, but saying like, hey, you didn't get the vaccine. And those two medications I mentioned, those are for patients who've gotten the vaccine, not gotten the vaccine, right? So, and because we know that just getting the vaccine does not prevent you from getting COVID, does not prevent you from being symptomatic. So you can get those, you can still take, like, you can get the vaccine, still take a medication like this here to try to prevent the hospital stay. So I think two big game changes that are on the way. Like I said, I'm excited. Because like I said, I want this pandemic to be over too. Like I 100% do. Like I said, you saw the numbers right here in the United States, 759,000 people, right, who will not be having Christmas this year, right, because of a virus that wiped them out. And just in comparison, right, for those who may be wondering, like, how bad is 759,000? First of all, it's a crazy number, right? But just in case you were wondering, it would take the flu 10 to 15 years to kill the same number of people. If you wanted just to get an idea of how bad COVID-19 is, like here in the United States, as far as mortality, it would take the flu 10 to 15 years to do what COVID-19 has done in less than 2, right? So again, just, just phenomenal, things to come, right? Protect yourself, wear your mask, get vaccinated. If you don't get vaccinated, understand that, there's some weapons that are coming down the pipeline, right, that could still prevent you. Because again, my goal is that you never have to see me, right? Like, that's the goal, right? I just don't want you to have to see me in a hospital from COVID, right? Like that is the overarching goal. How can I prevent from seeing Dr. Pierre in that hospital, right? Because I got COVID. Right? How can I prevent getting intubated because I got COVID? How can I prevent getting a feeding tube because I got COVID? Like that is where a lot of our discussion happens. Again, if you ask me, best way to do it, obviously, is get vaccinated, wear your mask, social distance as much as you can, right? Do what you got to do, right? Like that's obviously the goal, right? But understand that we do have some medications down the pipeline that's going to help. That even if you do pick up COVID, do get symptomatic from COVID, you still have a weapon in your battle to fight if it happens, right? But understand that we will not get out of this pandemic until our poor countries, right, our poor nations are able to receive treatment at the level that the United States, the United Kingdom, and countries like that are able to receive, right? Like it does not happen, right, until like it's at least equal. Again, that number was just sad. Less than 10% African countries and nations are going to hit a goal of 40%. Less than 10%, y'all. Like it's just sad, scary to hear. You guys be safe. Like I said, I'm going to be chilling all night here in the hospital. Like, again, you see my bed. I'm going to be chilling here all night, taking care of patients. Y'all guys be blessed. Happy Friday. Enjoy your weekend. I'm not sure what plans y'all got, but enjoy your weekend. And again, when we will start doing these again on Fridays, I think we used to do them Thursdays or Fridays. I forget which day we used to choose it. But we'll start doing this again, right? Like, I went on live this morning, and one of my supporters was like, "Hey, when you gonna do the thing again?" And so we're here, right? So again, shout out to you. He's on Instagram, so he or she, I'm not even sure if it's he or she. Shout out to you on Instagram. Again, I'm not sure where you're following me at, especially my other social media platforms. Check out the YouTube page. Go to watchdrbarry.com. Podcast, listen to Dr. Barry. We have you get obviously Instagram. We do the social media. Like I'm pretty much everywhere, right? Pretty much everywhere. Like that's the goal, right? So you guys be blessed. Have a great evening, right? And we will see you when we see you.